A lot of people tend to think that pain just comes out of nowhere or it is random, or better yet, I think I slept funny. When in all reality, the vast majority of our aches and pains come from one underlying factor, which is poor biomechanics. Hello, everybody. I'm Dr. Michael Brandon, chiropractor at Functionised in the Fit Clinic. I'll spend just a couple of brief moments letting you know what biomechanics are, why they matter, and most importantly, what can we do to help improve them. So biomechanics is just the study of motion and movement, how our joints, bones, and muscles all work in tandem to help us do what we're trying to do in an effective manner, whether it's standing, sitting, running, breathing properly. It all helps out so that way we have minimal stress on our entire body and decrease the amount of pain. When we have good, proper, and sound biomechanics, we do this very efficiently and effectively. However, if we have a little kink in the chain, maybe we've got a joint that is stiff, maybe there is some muscles that are tight, we have muscle imbalances. This can cause a very rapid cascading effect that can lead to dysfunction and pain in several different areas. So real life examples of this is imagine all the times that we have pain in our knee and we think it's due to arthritis. Have you ever stopped to think maybe it's due to having tightness in our glutes, or maybe our quad is over dominant towards our hamstring, or we just have no ankle mobility? Or how about wrist and elbow pain? How frequent this is? It usually comes from shoulder instability, from us being in a prolonged position on the mouse all day at work, or when we're driving, we have our shoulders up in positions that we weren't fully meant to do. This is why medicine can frequently help with the pain, but it comes back because it doesn't go ahead and help the problem. So, if our biomechanics are off or there's suspicion of such, what are we supposed to do about it? First and foremost, find a competent expert that knows what they're doing so they can do a full assessment on you. When they do, make sure that they go directly for the problem. Meaning, ways I usually do this is look for, is there joint restrictions? And maybe I need to manipulate the spine or an extremity joint. Maybe we have to work on the soft tissue to do a myofascial release, stretching, or some other modality as such. Maybe there's postural corrections, or we have to go into gait retraining. There's several different things that we can do, and all comes down to the individual and what are you trying to achieve. So when you have these aches and pains and they're coming and going, let's think about not why is my pain hurting right here, but what else might be happening that we do on a daily basis to cause it? Because most of our pain comes from repetition over time, and the better biomechanics we have, the less frequently we are to hurt and keep injuries at bay. Thank you very much. I'll talk to you guys all again soon.